Okay, let's talk about how to put our back table and our mail stand up to the patient. We're always going to start with the mail stand. The mail stand we're going to bring up to the patient. Notice that it is too short to fit over the top of our patient. On the back, and I'll show you guys this in a minute, but on the back of the mail stand at the bottom there's a button. We press that button with our foot, we lift our mail stand up, we take our foot off of that button, and now our mail stand won't move. I want you guys to see though, if I hit that button with my foot and I don't have control of this mail stand, okay, it's gonna fall, and that's gonna fall right on top of our patient. We don't want that to happen. We are fortunate that our mail stand cover got caught inside of our mail stand. It actually didn't crash all the way and possibly injure our patient's legs. So, mail stand we bring up, and it goes right over the top of the patient. I am short, so I want my mail stand down as far as I can put it. However, I want to be able to put an arm underneath here. I don't want this resting on my patient at any point, okay? It will cause a pressure sore if I do that. Now, you guys notice how we set up our mail stand? We have all of the toys for the toddler to play with while we go get our back table. So we want to make sure that the toddler has all these toys that will keep them busy while we go get our back table. That way they're not running around unsupervised. So we go get our back table. Hands staying on top of the back table. We put it right next to our mail stand. Let me turn the camera and show them like how this looks all together. There we go. So see how we have our mail stand and our back table right next to our mail stand. Everything is right here at my hip. So now I can do everything for my mail stand, but if I need something for my back table, it's right here. Remember that surge techs are efficient. We're not lazy, we're efficient. We don't want to have to take a step backwards. I don't like that movement, okay? I want to be able to just reach. So that's why my instruments are super close to my basin, so that I never have to leave this patient's side. I can stay right here the whole time. Okay, can we turn back this way now, Mr. Camera? Thank you. All right, light handles. Light handles, if your surgeon hasn't already put them up, you're going to hold on to the side of them, and you are going to tilt your head to the side so that your arm has room. Watching your hand, you're going to slide these right up here and stop. Okay? Same thing on the other side. Now, being super short, if I can't reach this, I'm going to ask my surgeon to do this. I'm not going to try and reach way over the table and lean way over my patient. Remember, my face isn't sterile. Okay, my armpits, not a good idea to have over the top of the patient. So, if I can't comfortably reach that, I'm going to let my surgeon do it. Suction tubing. Most of the time, your suctions will be located close to anesthesia, because if our patient aspirates, we want to make sure that anesthesia has access to the suction to be able to save that patient's life. So I open up my suction tubing. Half of it goes off to the suction machine. I just throw that off. Now our drapes have these nifty little Velcro pieces, and I'm going to tuck that down there. I'm fortunate that this drape has a pouch. I can actually tuck my suction tubing in there, and now it won't fall off the field. And if this is bothering my surgeon, I can tuck that little bit of tubing in there as well. Last but not least, we have our Bovie. Your Bovie holster can go one of two places. We can tuck it into the front of the mail stand, or there are these Velcro pieces that right now are underneath our mail stand. And I can loop this underneath here and put it there. However, I always want to make sure that this holster is somewhere on my field, okay? You never want to have this holster just running amok not being able to be utilized. So I'm actually going to put my holster right here on the front of my Mayo stand, closest to my surgeon. And the bovie always gets tangled. It's just a fact of life. Doesn't matter how many times you run it beforehand. CST stands for Certified Spaghetti Tech, as well as also Certified Surgical Technologist. We deal with lots and lots of spaghetti. We want to make sure that we have enough cord that we're not going to have to pull this cord back once we send it off the field. So we make sure we have enough cord. Bovie goes in there. Our cord is definitely going to be stuck down with one of these Velcro pieces. Stick my cord in there. The rest of my cord is going to go underneath my Mayo stand, depending on where my bovie is. Since my bovie is at the foot of the bed, that's where it's going to go. And I just toss it to my circulator and they will plug it in. Now we are ready to almost begin the procedure. Last thing we have to do before we can make an incision, we are going to do a timeout. We never ever hand a scalpel until after we do timeout. Timeout is very, very important to prevent wrong site surgeries, wrong patient surgeries. So even if you're sure, you know Jim Bob from your hometown, you know what he looks like, you know who he is, you know what he haven't done, we're still going to do timeout. Doesn't matter that you know Jim Bob. So we're going to say, timeout. This is Jim Bob, Billy Joe, Raymond, Travis Wade. He is here for an umbilical hernia. He has no nerve drug allergies. Consents are signed and witnessed. Is everyone in agreement? We ask that question always. Is everyone in agreement? Because we want to make sure that everyone in the room knows what we're doing. If anesthesia is like, wait a minute, I thought we were doing an open heart. Well, anesthesia has the wrong patient, or we're in the wrong room, or something. So we want to make sure that everybody is in agreement as to what we're going to do that day. Are there any questions is the final part of that statement. Asking if there's anybody who has any questions at all about what we're doing today, let's ask them now. Let's not do it before, while the case is going, let's do it before the case actually starts. Once timeout is complete, then I'm going to put up one ray check at the top, one ray check at the bottom. I do not move during timeout, okay? Timeout means exactly that, timeout. Everybody in the room pauses. All conversation stops. We all look at the surgeon who is going to lead the timeout. So, once timeout is complete, then we can move again. We can do whatever we want. We can have side conversations. We can do whatever we want. Now is when we are going to hand the scalpel to our surgeon. Okay, Kim.